Patient Information in Anesthesia, a survey-based service evaluation study of post-operative general and regional anesthesia patients in University Hospital Waterford. Production. Based on the HSE National Consent Policy, a healthcare worker may only carry out an intervention on the basis of a valid consent unless in an emergency. In University Hospital Waterford, anesthesia information can vary from a preoperative clinic session to a few words prior to surgery. This leads to variability in the quality of information that a patient receives. Aims to gain insight into patient experience and satisfaction with anesthesia information received preoperatively, and to compare patient experience between those who did and did not attend a preoperative anesthesia clinic. Methods: Post-operative patients were identified from the theatre list for a period of 7 days. A 10-question survey consisting of mainly Likert questions was conducted. The key topics addressed were clarity of information, opportunity to ask questions, satisfaction with information, and decreased anxiety. We included post-operative patients who had a signed consent form for their surgical procedure. Exclusion criteria included emergency cases, cases where consent is not applicable, patients that were unstable, intubated, or otherwise unable to participate, and patients not willing to voluntarily participate. Results. A total of 26 patients participated in the survey. 15 were male, and the average age was 54.4. 13 attended a preoperative anesthesia clinic, and all patient information was delivered verbally with no leaflets or online material. Likert questions answers were given a score from 1 to 5. Data distribution was non-parametric across all questions. The data was stratified based on preoperative assessment clinic attendance, and the Mann-Whitney test was utilized and showed no statistically significant difference between the means. Thematic analysis was used for the suggested improvements question. Common themes mentioned were no need for improvement by 7 patients and overall happiness with experience by 4 patients. Conclusion. The p-value for decreased patient satisfaction with information when not attending preoperative clinic was 0.065. A larger sample size may have provided stronger results. Although the study findings were not statistically significant, it is likely that patients who attended preoperative clinic are more satisfied with information received about anesthesia. The department may benefit from service improvement plans to ensure equity in anesthesia information between patients who attended preoperative clinic and those who did not. This can be in the form of a patient information leaflet that standardizes the information received for all patients.